pressure control ventilation in 60 seconds. In this mode, the ventilator delivers air until a preset inspiratory pressure limit is reached. It is a fundamental setting used to protect sensitive lung tissue from overdistension. Understanding how it regulates flow is the first step in mastery.
In pressure control, the tidal volume is not fixed and fluctuates based on the patient's lung compliance. If the lungs become stiff or resistant, the volume of air delivered will automatically decrease. This mechanical relationship means that the air reaching the alveoli changes with the patient's condition.
Your primary nursing focus is to monitor the exhaled tidal volume closely, especially in patients with worsening lung pathology. Watch for sudden volume drops, which can signal a change in clinical status or a blocked airway. Always remember, in pressure control, pressure is fixed, but volume can vary.